Yes, sir. Yes. Sorry, sir.
Anyways, well done, Kanchan. Next speaker, Dr. Ramya Yanti. Dr. Ramya, please. Would request all the speakers to load their presentations with the AV team at least if possible.
Dr. Ramya, a study on effect of artificial tears of different viscosity and keratometry readings in cataract patients. There are no financial interests or relationships to disclose in this study. Introduction. Artificial tears are lubricating eye drops used to relieve dryness and irritation of the ocular surface. They are used to supplement a patient's naturally produced tears and increase eye lubrication by mimicking characteristics of tear film. Aim was to study the effect of high viscosity and low viscosity artificial tears on K readings in cataract patients. Objectives to assess the effect on high viscosity artificial tears on K readings in cataract patients and to assess the effect of low viscosity artificial tears on K readings in cataract patients. Materials and methods. Study type, it's observational study. Sample size 90 patients divided into 3 groups. Group A 30 patients of high viscosity and group B 30 patients of low viscosity and another group is control group of 30 patients. Sampling method is a convenient sampling of duration 2 months. Study setting was done in Department of Ophthalmology, Tertiary Care Center. Methodology was to obtain Institutional Research Committee and Ethics Committee approval to conduct the study by submitting the protocol. Written informed consent was taken and to record the patient demographic details. After a comprehensive ophthalmic evaluation, all the patients are undergone this evaluation. Keratometry readings K1, K2 of both eyes were noted before installation of artificial tears and after 5 minutes of installation of artificial tears, and changes in keratometric readings are noted. Study tools for Snellen's chart, refraction room, slit lamp examination, ARK for measuring the keratometry values. Inclusion criteria. Patients with bilateral cataract without any ocular surface diseases were included. Exclusion criteria. Eyes with corneal pathology, history of trauma and ocular surgery, corneal or conjunctival infections are excluded. The statistical analysis, the collected data was entered in a Microsoft Excel and analyzed using SPSS software. Statistical analysis was done using paid t-test and ANOVA test. P-value less than 0.05 was considered statistically significant. In the paid sample t-test, within the groups, the p-value has been less than 0.05, hence it shows it's statistically significant. In the ANOVA test, between the groups, the p-value is less than 0.05, hence it's statistically significant. Coming to the discussion, a present study done in a tertiary care center, a study on effect of artificial tears of different viscosity and keratometry readings in cataract patients. The sample size was 90 patients. The conclusion is tear film stabilizing eye drops prior to keratometry measurements influenced K readings significantly. The higher the viscosity of the eye drops, the stronger the influence and the longer its persistence. Another study, Epitropoulos et al. Has been done a study on effect of osmolarity on repeatability of keratometry for cataract surgery planning. A sample size was hyperosmolar group of 100 eyes of 50 subjects and normal group 50 eyes of 25 subjects has taken. The conclusion was statistically significantly more subjects with hyperosmolar tears showed poor repeatability of K values. A shared R has done a study on optimizing biometry for best outcomes in cataract surgery. Sample size was 28 patients. The conclusion is within modern optical biometry for majority of patients informed formula choice and IOL constant optimization outcomes. The conclusion is tear film stabilizing eye drops prior to keratometry measurements influenced K readings significantly. The higher the viscosity of the eye drops, the stronger the influence and the longer its persistence. Thank you.
What is new about this study? Because this is a proven fact that one should not be giving any form of eye drop. It should always be done on a virgin eye once the patient is coming for cataract surgery. So K reading is always taken prior to it. So is there any new information you would like to give?
But ma'am, without installation of, there is difference between installation of eye drops on K readings and before installation of eye drops of K readings. For a cataract surgery, the calculating the IOL power is very crucial in the cataract surgery patient. So there is difference in K1, K2 values before and after the installation of eye drops.
Yes, that is what. There's nothing new information in this. That is why if patient is coming with dry eye and if maybe the Myers are distorted for K readings, then we, give lubricating dry eye drops. We ask the patient to come another day. So that is the followed protocols everywhere. So any new information this is giving?
No, no, ma'am.
Okay.
In this study, we have instilled the eye drops and we have taken the readings after 5 minutes of installation of eye drops.